first started my Clubfoot journey when my son was born with Clubfoot in 2003. So it'll be 20 years next year. And STEPS was founded in 2005, primarily to bring the Ponseti method to Southern Africa as an extremely useful and efficient way of treating clubfoot. And in the beginning, it was a bit like feeling like a voice in the wilderness, very isolated, not much. There was a group of people that were talking to each other, and it didn't really feel like the rest of the world really knew what was going on. And I'm just finding that not only this conference, but so many other initiatives and projects that are happening around the world are getting more interest. I think the conference has been a great catalyst to engineer the interest that's needed to be. We need to increase conversations about clubfoot. It's not, although it's the most common birth defect, it's not very well known, and because it's treated quickly in countries that have resources. So people don't see children walking around with clubfoot, but it is certainly something that happens in less developed countries. And so the sooner we can get this message out to as many people possible and remove the stigma and ignorance around clubfoot, the less chance there is that any child has to grow up with an unnecessary disability. And this has been really the core purpose of STEPS since we started. And we use a 4-pillar model, which is based on clubfoot advocacy, removing stigma, supporting clubfoot clinics. We have got 38 clubfoot clinics. We've got an award-winning model which provides resources and fills in the gaps that are sometimes involved in state-funded health, just because there aren't enough resources to go around. We're very much focused on patient-centered care. We've created parent education materials which are now in 7 or 8 languages, and used not only in South Africa but around Africa. And we've also there's a medical device that's used for clubfoot. In fact, some of our supporters of the conference are manufacturers of these medical devices. It's an essential component of clubfoot care. We have, as an organization, sourced the products that hospitals need. It's now created a social enterprise income stream for us, which goes back into clubfoot programs. And lastly, most importantly, probably this is how STEPS started, is training. We train health professionals regularly because a medical degree is not going to focus a lot on clubfoot unless that person's working in a clubfoot clinic under mentorship of a doctor treating clubfoot. It is not intensely covered on a standard medical degree, whether you are doing being a physiotherapist, occupational therapist, a doctor. So we offer specialized courses, and we work in partnership with the South African Pediatric Orthopedic Society, which we have since the start, and it's made us a very sustainable model, and the growth has been exponential. I think that it's time for Africa to be part of the conversation because we have a lot to share with the world from our experiences, and I think that as things are happening around the world, it's becoming more and more apparent that a lot of innovations come out of Africa, and perhaps we need to put more spotlight on this. And our organization, STEPS, who's running the conference and hosting it, is actually part of an umbrella group of organizations that work to expand clubfoot treatment called the Global Clubfoot Initiative. There are many African-based organizations in that under Global Clubfoot Initiative, and I've noticed that there's more and more mobilization and interest from various sectors in what we're doing. The fact that we work together as a group, we are seen as a great example of how to expand treatment, we focus very much on the patient's experience and just using resources in the best way possible so that we can expand and treat more children.
I think from the SCT point of view, and I've got years of communication and with Karen and being to workshops. I mean, this is a game changer in the management of clubfoot, and this gives access to the continuum of care, and as interest shown in most of the African countries, including South Africa. What amazes me is they are dedicated and passionate caregivers who go beyond their call of duty to assist patients, which has improved the quality of life. And I've been to hospitals where when I see mums crying and when the babies and little ones, when the correction has happened and they can walk on their feet, it brings joy to your heart, and we are honored and glad that we have been included in the STEPS journey for a number of years, and especially Karen, who has been an inspiration to a number of people and professionals. SCT is a global and healthcare company. There's a long journey. I'm 37 and a half years with the company. On the onset, we were Smith and Nephew. Over the years, Smith and Nephew, we had parted ways. In 2001, BSN was born, where Bayersdorf, who we used to do Nivea products, went on their own. We used to do Elastoplast, which Acantia went on their own. We used to do Lillet's. And once they split and they became their own entities, BSN was formed in 2001, Bayersdorf, Smith and Nephew. We do orthopedics, we do wound care products, we do fibrology and stockings, etc. In the last couple of years, we've been bought by a Swedish company called SCA, and now we are known as Essity. Orthopedics is a big business for us, which we have plaster of Paris, we have synthetic casting, we have undercast padding, skin traction kits. Now, these products is an integral part of continuum of care. For argument's sake, in Africa, with price challenges, plaster of Paris is the number one choice, and we have to make a product that basically conforms to the patients and caregivers. And as I say, Essity is a conglomerate which is based all over the world. We have factories in Americas, we have factories in South Africa, we have factories in Europe, we have factory in Asia.
Well, on our part, I deal on the bracing side of our nonprofit through the University of Iowa. Ponce International, Dr. McQuende and his team, they do all the training, they do all the hard work, right? So I'm the branch of the stool that takes care of the bracing needs after the healthcare workers are trained and that type of stuff. So for us, Africa, we've been sending braces over to programs in Africa since 2015, and we're up north of almost 15,000 braces that we've sent over there, and we're just denting it. That's just a dent, and the largest issue we have in Africa is the ministries of health are still not paying for the braces. Many of them are paying for the casting techniques now. I know in Nigeria they are, in different places, but the braces still seem to be the problem. For the families of having a quality brace that's paid for, that they can use on their child to correct their feet. Because as we all know, the doctor does the magic. He's the one that corrects the feet, and the healthcare workers correct the feet. And then it's the parent's responsibility to make sure that clubfoot deformity doesn't relapse. They must wear that brace, and it needs to be a very comfortable brace for that child that they can put on and wear during their treatments. So they do that for the 4 years to ensure that bracing is correcting the feet. So I think for Africa and the countries in Africa to look at this as a long-term solution, number one, they need to get the doctors trained, healthcare workers trained. B, number two, those healthcare workers and doctors need to be the champions, the ministries of health, to say, hey, we can solve a problem here of a deformity that's leaving children crippled and adults crippled in your country. And then number three, we need to make sure parents are educated and we have braces we can provide to them at a low cost or no cost, so we can ensure that child is going to be corrected. We all know living off of nonprofits, long term, for me to send over 16,000 braces to Africa through donors in the United States or other places is not a long-term fix. We're here to get programs going, to show we have the capabilities of mass producing comfortable braces at a very low cost for these countries. That's our mission. And then for them to take over and say, hey, we need 10,000 braces to go to this hospital in Nigeria to last us for the next 5 years. And then we'll do another manufacturing run for those people too. So that's our goal. Hopefully over time here, that goal will come to fruition here. We've seen the goal do very well in other countries throughout the world. Like I said, Mexico is doing very well for us right now. Philippines is doing very well for us right now. We've implemented some of these things. Latin America, South America countries are doing really well right now. And we really think Africa can be that next step. where the governments are getting involved, and we're seeing this clubfoot deformity be eradicated.